Hello YouTube, I'm Dr. Fox. Today, I'm talking about women and preconception health. Preconception health can benefit all women regardless of whether they are planning to have a child in a year, 5 years, or never. The primary concern of this approach to health is getting people to adopt healthy habits and stick with them. Taking care of your health will improve your total well-being now and into the future, and thus, many health professionals have encouraged all women to prioritize their health. While eating well and exercising are important to get and stay healthy, these are not the only things you need to think about. Moreover, it is important to recognize that a lot of pregnancies are unplanned. In some countries, as many as 50% of all pregnancies are unplanned, so you may become pregnant unexpectedly, making preconception health all the more important. The following is a list of 10 steps to improve your preconception health. Okay, let's get started with step 1. Create a plan and act on it. If you are planning to have children and if you are planning not to, you need to think about your reproductive goals and make a plan to achieve them. Think about if and when you want children and how many, and act on your plan. Step 2. Visit your doctor. You should be visiting your doctor every year for a checkup, and this is a great time to discuss preconception health care. Don't wait for your doctor to bring up the subject. Ask them about preconception health yourself. When discussing preconception health, make sure you talk about any medical conditions that you have and whether they are being properly managed. For example, you may suffer from thyroid disease, seizure disorders, arthritis, chronic conditions, eating disorders, diabetes, and sexually transmitted diseases. Also, address your lifestyle. Do you smoke, drink alcohol to excess, or use illegal drugs? By talking to your doctor about your lifestyle, you can get information on the support services you may need, such as treatment or counseling. Finally, are you up to date with your all vaccinations? Make sure you are. Okay, step 3. Quit smoking, using drugs, and drinking to excess. You can cause serious damage to your health by smoking, using illegal drugs, and drinking too much. Also, if you're pregnant and don't yet recognize it and continue to smoke, drinking, and use drugs, your baby could suffer from potentially serious birth defects as a result. If you are finding it difficult to stop your drug use, smoking, or drinking, help is available. Your local healthcare provider or treatment center can give you the information and support you need to quit. Step 4. Getting the right vitamins and minerals. It's important to eat well and get the nutrients you need. In particular, the B vitamin, folic acid, is essential to staying healthy. You should be taking 400 milligrams of folic acid daily, as this vitamin helps the body to make healthy new cells. Your nails, hair, skin, and many other body parts generate new cells every day. Also, if you become pregnant, folic acid will help to stop your baby from developing serious birth defects affecting their spine and brain. Step 5. Get to a healthy weight and stay there. If you are overweight or obese, you will be at greater risk of several serious health conditions such as type 2 diabetes, heart disease, and endometrial, breast, or colon cancers, among others. Being underweight can also result in a variety of potentially fatal health conditions. Getting to a healthy weight and staying there is about making long-term changes to how you eat and how much physical activities you do. If you pursue a lifestyle that includes healthy eating and regular exercise, you will be able to maintain a healthy weight, which will contribute to your physical well-being. If you are concerned about your weight, discuss it with your doctor or another healthcare professional. Step 6. Stay away from harmful materials. There can be a lot of harmful materials and toxic substances in the home and workplace, including synthetic chemicals, metals, fertilizer, bug spray, and cat and rodent feces. If you are exposed to these substances, they can damage your reproductive system. So it is important to learn how you can avoid being exposed to harmful materials wherever you are. Step 7. Seek support to deal with domestic violence. Domestic violence can impact you as a child, an adult, and into your older ages. Each year, numerous women die as a result of domestic violence, but many more live with the physical and emotional effects of physical abuse. If you are experiencing domestic violence, you must seek help. Step 8. Learn everything you can about your family's medical history. Understanding what diseases and conditions have affected the members of your family over the years can help your doctor to give you the best care they can. Information about your family's medical history can help your doctor identify diseases you're at risk for and suggest interventions to decrease your likelihood of getting certain conditions. Moreover, it can put your doctor on the lookout for the warning signs of a condition. Step 9. Don't forget about your mental health. Physical health is just one part of the puzzle. Your mental health, that is, how you think and feel and cope with any issues in your life, is another. It is normal to get stressed or anxious or even feel a bit down at times, but if these feelings continue long term and start to affect your day to day, you need to seek help. You can't be at your best if you do not care for your mental well-being. So don't be afraid to discuss how you are feeling with your doctor or another healthcare professional, and they will be able to suggest treatment options such as counseling or medication. Last, step 10. Planning for your pregnancy, if or when you're ready. If you're ready to have a child, it is time to plan for your pregnancy. It can take a few months or much longer for a woman to prepare their body for pregnancy and increase the likelihood of a healthy pregnancy and baby. As good health is always a benefit, it is always the right time to take steps to improve your health and start planning for pregnancy. If you do not want children or aren't ready yet, you need to know how to effectively prevent pregnancy. There are many very effective and very safe birth control methods out there. All you need to do is talk to your doctor about your options and what would work for you.